What we represent, man?
Big Money Bound.
Say, let her know, man.
Big Money Bound TV, RRT Posse, YouTube. If you're new to the channel, please like, subscribe, and turn on post notifications. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time, but I also release some unscheduled videos throughout the week. Now, if you're returning, welcome back. I appreciate all of the support. Thank you. Just finished working up my night shift, man. Just finished working the night shift as a respiratory therapist. I was downstairs in the ER. Bro, I'm tired, dog. But even though I'm tired, I'm still gonna bring that car talk that you love, you feel me? That car talk that, you feel me? That this is the episode 108. Car talk video 108, man. Hey, we did a lot, didn't we? We did a lot. We've been through a lot, man. And I'm saying we because without y'all supporting it, I have no reason to keep going. So this is a joint effort, team effort, bro. You feel me? As long as y'all supporting, I'm gonna keep doing it. So we gonna be all right. But last night I was covering the ER again. They had me downstairs in the ER, man. My night started off like, bro, like haywire. Like things just going crazy. I came on. When I come into the hospital, first thing I do is, you gotta clock in, you on time, you getting paid. I then go and get my surgical scrubs. I ain't walking around the hospital in like my work, no, I'm using scrubs. You feel me? It's COVID-19 out there, ain't no COVID-19 getting on none of my clothes and I'm going home, so I wear the surgical scrubs. So I gotta go get that first things first. Then I go up to my department. I'm getting a report from the person that was in the ER from the day shift. They telling me, man, I gave a few treatments, everything was good. I ain't had no vents, no nothing, everything was good. As soon as the phone touched my hand, now, they calling me saying, what it was? I got a breathing treatment due. I'm like, all right, no problem. So I'm heading down. Then I get another phone call before I go out the door. You got a vent, a trauma vent, like a helicopter transfer. Patient was flown in. They here right now. They in the room. They waiting for respiratory therapy. Bro, whoa, like no heads up, no nothing, man. We got to do this stuff on the fly, bro. That's the only thing that's like difficult about working in the ERs, man. The heads up times is like, sometimes you get a heads up, sometimes you don't get a heads up. But either way, like I told y'all and like I tell y'all, I got one speed. I'm working fast and efficient every time. I don't got no turbo speed Sonic the Hedgehog button that you can press. We here right now and I just, and I get that. I can't do it. Now, if y'all can do it, drop in the comments and let me know. But me personally, I got one speed, dog. So I'm headed down there. And as the ER respiratory therapist, you have to like fax over the master sheet with all the respiratory therapist phone numbers on it and what floors they're covering. So if anybody calls the operator asking for a therapist for that floor, they know who the therapist is for that floor. I didn't have time to do that. I had an emergency situation downstairs in the ER. You feel me? Like, I ain't got time, but when I get time, I'm gonna try to do that. So I'm in that, man, getting my vent set up, putting on my hardware, checking everything. I'm getting the call. Operator like, hey, man, yeah, we never got that on paperwork. I'm like, all right, I'm busy right now, but you know what? Call the supervisor. They like, yeah, we don't got a supervisor number, that's why we need the paper. I'm like, all right, I got you, man, but right now I'm in an emergency situation. As soon as I get a chance to get free, like, I'll send that to you, no problem. They're like, okay. They was like, okay, like, I'm kind of like slowing them down. And I understand, like, they need it, but bro, like, I'm needed. I'm over here, you feel me? This is an emergency. So I ain't had no time to give it, bro. I ain't had no time to do it. My bad, man. I just did 12 hours, dog. Like, hey, bad as you want it, dog. You may be a little sleepy. But hey, them bands keep stacking up. You'll wake up. You get that check, you'll wake up. Trust me, you're going to wake up. So, put the patient on the vent. I'm going to get an ABG in like 15, 30 minutes. So that's going to give me time to send this paperwork off. But, I get another call. You know, well, I don't know if you know, but when a patient comes in like drug abuse, drug overdose, highly intoxicated, opioid use, cocaine, heroin, don't know what they've been on, perky, Xannies, they just real woozy and oh, I get so high. They on that vibe, you feel me? And they like out of it, completely out of it. And they may be breathing a little bit funny. Anything related to too much drug use, they give Narcan. Narcan is a drug that reverses all that nonsense that you got going on and wake you straight up. So you can be high from all kind of drugs and Xannies. You going, what? I seen this drug wake people up that was dead, bro. Dead sleep. I tell you, no lie, from like heavy drugs, like knocked out, not breathing properly. Wake up and be like, damn, that was fun. I promise you, man. So we got a patient like that coming into the ER. Patient, they said the patient was using some drugs. Okay. Doctor tell me, I want to put in nasal trumpets. And that's the thing, bro. Like, let me know in y'all school and y'all program. Are you being taught how to put in a nasal trumpet? Because I was never taught how to put in a nasal trumpet, but I was taught how to do nasal tracheal suction. And it's basically the same thing. A tube going to somebody's nose, you lubricating it, and you putting it down there. As you put it down there, you kind of twisting it, and it's just going to follow the natural path for the human anatomy. You feel me? That's what I'm doing, but nobody actually like, you know what? Oh, we talking 2013, 2014, dog. To be honest with you, cuz, if I did learn it in school, I don't forgot, dog. I feel like I ain't learning, but I probably did. You feel me? I don't want to shoot my schools in the foot. But dog want me to put in 2 nasal trumpets, both nostrils. All right, I do that. Then dog, then they want to say, put in a nasal cannula. Bro, I'm not finna put in a nasal cannula, man. We finna really clog up the dude's airway. He finna really be clogged up. So what I did was 2 nasal trumpets and a Venturi mask. You feel me? Then doc like, yeah, man. I don't like how you look. I'm finna intubate. I'm like, bro, you don't gotta like. I thought it was a little bit aggressive to do intubation, but hey, I'm not the doctor. Doctor said we finna intubate. I get my intubation equipment. I get my ventilator. I get my ambu bag, HMEs, holuses. I'm ready to assist you, dog. I can't tell you what to do. I can recommend something, which is what I did. And you said you want to do what you want to do. Hey, where you want me at, dog? Where you are? I'm clocked in. Where you want me at? You feel me? But it's like, I know how Narcan work. I know how drug overdose patients work. Majority, 99% of the time, the Narcan gonna wake somebody up. But it's that 1% that sometimes it just doesn't work. So I'm assuming we already tried that. I'm assuming that's already been done. The patient been here an hour. I'm assuming that's already been done. Then dude say, you know what? Another doctor just gave me a suggestion to try Narcan first. What? I'm like, try Narcan before you should. That's like, but even by saying, had I said like, you didn't try Narcan yet? Like, even though that's the first thing they do, I'd be insulting the doctor. And I ain't trying to do that, but that's the first thing you supposed to do. That's like me being a respiratory therapist. I call another respiratory therapist to come help me. And I'm saying, hey, this patient's SATs is low. I can't seem to get it up. Can you come up here and help me? No. This patient's SAT is low. It doesn't seem to be going back up. Can you come up here and help me, please? The last thing as a respiratory therapist, the last thing you're going to ask another respiratory therapist is, did you put on oxygen? Because that's the first thing. That's what that's equivalent to for a doctor. Narcan and a doctor. Bro, you ain't giving Narcan? You're a respiratory therapist and you ain't putting nobody on oxygen? Dude was asleep, man. Nasal trumpets in his nose. They gave that dude Narcan. Within 15 seconds, dog went the hell is in my nose? Dog threw out what was in his nose, man. Like, what's in my nose, man? Bro, man. Hey, man. That was like, I was beyond shocked by that. I'm like, bro, we didn't get you. I thought we been gay Narcan, dog. You ride in the car with your homie, the car break down. The last thing that you're gonna expect to happen is that your homie ain't put no gas in the car. That's the first things down first. So that was a situation, and it's like, I don't know what's going on, but like, it don't seem like people taking that COVID situation like as serious as they once was, you feel me? It's like we kind of like loosening up on the protocols and all of that, bro. But me personally, I'm gonna do what I gotta do to protect myself, bro. I'm gonna protect myself, man. If anybody else gonna protect me, I'm gonna protect me, you feel me? Because like, something happen to me and I get sick, bro, they gonna send me home and that's it, dog. I can't work no more. They gonna put my job up for a new open position and somebody else gonna come fill it in. So I'm gonna protect me off rip, man. They calling me saying I got a treatment in bed, 79D. All right, what's the patient COVID status? Oh, the results are, we still waiting for the results to come back. Well, you gonna still be waiting for this breathing treatment too, though. You waiting for the results? You finna be waiting for this treatment. I'm not giving nothing till I know for sure a patient is negative, dog. And that's not even to like protect myself. That's to protect everybody that's taking care of the patient. You feel me? This is just stuff that like, I'm not, bro. COVID pandemic is growing and running wild and running rampant. It's back, dog. It's back. It's back with a vengeance. It never left. It got its wind, now it's bouncing back. And it's like, hey man, I'm done, dog. I've been on here talking dirty if I keep going, dog. Y'all be safe, y'all be easy, dog. Protect yourself, dog. You don't feel like you should do something, don't do it, dog. That's where I'm at with it. I'm straight, dog. I'm good, cuz. I'm still wearing my PPE, head to toe, cap, gown, mask, shield. I'm wearing the shield, then I got on goggles underneath my shield. Call me what you want to call me, dog. I'm scared. Ain't I wavy, though? Ain't I wavy, though? No, ain't I wavy? Come on, dog. Y'all, it's possible. Bring that back. Bring that back.